Welcome to the DSA Shifting Perspective podcast.
Hello, my name is Richard Bailey and you are listening to the Shifting Perspectives podcast. Today we are very lucky to be joined down the line by Dr. Liz Herrievan. Hi Liz.
Hi, hello.
Liz is a consultant in emergency medicine and paediatric emergency medicine. Amy, her eldest daughter, who is 13, has Down syndrome and autistic spectrum disorder. Liz has created a special infographic for the medical profession about treating children with Down syndrome and how they can present differently for medical conditions. She's written blogs, recorded podcasts and spoken at various conferences about this. So it's really nice to be able to talk to you, Liz, and I'd like to talk to you about the infographic and how it's been received by the medical profession. But first, I think it'd be nice to hear a bit about your family and about Amy and what she's like.
Toby is 7, nearly 8, and he is obsessed with football. And he's actually quite a good little brother. Amy is 13, and she has, as you say, Down syndrome and autism. She is obsessed with Ed Sheeran. She likes Little Mix. Her favourite thing in all the world is to pack her bags for pretend sleepovers. She doesn't go on the sleepovers, she just constantly packs things for the sleepovers and plans what she's going to take and where she's going to take them.
I understand that Amy was quite poorly in her first few years. Maybe you could tell us a little bit about that?
Yeah, she was born early. She was 10 weeks early. So we had a long drawn-out stint in the neonatal unit. And then the next couple of years was taken up with being in and out of hospital, in high dependency and intensive care, with lots and lots of chest infections, pneumonia, lots of sepsis, even chickenpox. She went to the extremes and ended up being airlifted across the country to spend a week in intensive care. So it was a fairly rocky couple of years.
See, did that affect you personally, particularly in your role as a medical professional?
Massively. I was so used to being on the other side, being the one in control, making the decisions, and then all of a sudden I have lost all control, and that's my small child laying there. So it was really difficult to get used to. But I think it actually taught me a massive amount about what it's like to be on the other side and to be a parent and to be the one on the receiving end of all the challenging news and having to watch your loved ones going through that pain and being so unwell. So I'm hopeful that has helped me when I'm interacting with parents since then.
I'm sure it has done. Now, Amy has a dual diagnosis of Down syndrome and autism. When did you start to notice her behaviour was maybe possibly different to her peers?
Well, I'd always had some niggles that she wasn't quite the same, but when she got to about 8, things really started to become apparent. She didn't want to play. She was very repetitive in her speech and in her actions. And she used to do a lot of kind of self-soothing behaviours, so pulling at her hair, for example, and flicking through books. And she became more and more upset by certain sensory things. And it just became more and more obvious that we were dealing with something other than Down syndrome on its own.
What did you have to do to get the dual diagnosis for Amy?
That was a really tough couple of years. We kind of knew ourselves and everyone we spoke to agreed, yes, it's likely that she has autism, but we had to go through all the hoops of getting the formal diagnosis. We were referred by our paediatrician, who was wonderful, to the social communication difficulties panel. And that took about just over 18 months, I think, to get seen by the panel members. And then each member of the panel then did a separate assessment of Amy. So even though she was already known to speech therapy, there was a new speech therapist to assess her, a new educational psychologist to assess her, a new paediatrician to assess her. And then eventually all of that went to a panel discussion. And I remember really clearly getting the telephone call to say, yes, the panel's decided that she has autism.
I didn't know that you had to do so many things. And has it helped having the dual diagnosis?
It has. It took a bit of time to get used to, although I knew in my heart of hearts that she had autism as well. There was that tiny part of me that was hoping that she'd grow out of all these behaviours and that one day I'd wake up and she'd be happy and smiley and playing again. So it took a lot of getting used to. But actually having that diagnosis has meant that we've been able to look into ways to help her. And we've done a lot of reading around autism and been able to figure out the things that will help her and the things that will make her worse. And again, with school as well, they've been able to do something similar to be able to support her.
And for instance, what kind of adjustments would you have to make to help Amy in her everyday life? For instance, does she need support at home?
So in terms of things we've done at home, we've had to do a lot of things to try and prompt Amy to remember things. So there are planners and charts everywhere. We have signs up in the toilet reminding her to wash her hands and how to wash her hands. We have lists on the kitchen cupboards of what she's due to eat at which meal times, because otherwise she becomes very upset about what she's going to have and when, and lots of repetitive questions. We have to be very careful about what we tell her about what's going to come up over the next few days, because she becomes very anxious about things. So, for example, if there's a school trip coming up, we ask school not to tell her, because otherwise we'll have a week or two of her being very distressed, saying, what am I going to take? Where am I going to go? How am I going to get there? What time do I have to be there? And it becomes really quite distressing for her. So we've had to watch what we say and do as a family. And that's led to lots of secret codes between myself and my husband. But it has actually made a big difference with Amy. She's not so anxious when she knows those answers to her repetitive questions are easy for her to find. And when we're able to do lots of prompting for her to remember sort of activities of daily living, I suppose. So she doesn't have to stress about remembering what to do and when. I think the biggest one, to be honest, is that we've had to change our expectations, and of all sorts of things. So not just of her life in general, but of also things like days out, holidays. We plan everything to the nth degree anyway, to make sure that we know that there's areas for her to calm down if she gets too overstimulated, that we avoid things that we know are going to set her off and make her upset and make her very distraught. But we've had to change our expectations of family life. So the summer holidays is always really difficult. I see pictures of all my friends on Facebook having lovely days out and lovely holidays, and we're just glad to get through it, and which sounds awful. But when I've been able to adjust my expectations a little bit, then it doesn't hit you so hard. I have to say that although we've changed our expectations, we still manage to have a really good family life. We just have to do things a little differently. So we go to the same place every year on holidays. We're not very adventurous. We know that if Amy goes to somewhere she knows and recognises, then she's more likely to be able to relax and enjoy herself. We do try our best to do things for our son as well. So quite often we'll take it in turns, and I will do something with Amy and my husband will do something with Toby, and then we'll swap round so that he still gets to really enjoy things that he wants to do, but that Amy is with somebody familiar in a familiar environment doing something that helps her to relax. Toby can be running around playing football all day, but Amy is thoroughly enjoying sitting in Starbucks and having a cup of coffee.
And I believe that she was at mainstream school, but you've eventually moved her away from a mainstream school to a special school for people with learning disabilities, which is, I guess, again, managing expectations. I mean, has that helped Amy?
It has massively, actually. Her mainstream school was lovely and the staff did a fabulous job, and they really did try hard for it, but it just became more and more apparent that she wasn't happy. She was under a lot of stress, and she needed to be somewhere else, and I think it was one of the best decisions that we made. I think the big difference I can see in her is that she's far less anxious, far less stressed. She actually enjoys school a lot more. She hasn't had to struggle to fit in, and that has made a big difference to her mental health, I think. It's not for everybody. Every child is different, and every child needs something different. But for Amy, it was the right thing to do.
Well, I think that's the recurring theme for all of these talks, is that all our children are individuals and we have to sort of treat them as individuals. So, I mean, would you have advice for families who are caring for someone who has a dual diagnosis?
I would say take one step at a time, particularly in the early days. Be kind to yourself. It's okay to feel that things are awful. It's okay to be sad, and it's okay to have that kind of grieving process. You will get through the other end. There will be good days, there will be bad days, but actually in the end there'll be far more good days than bad. Your family might not look like the wonderful family on the front of all the parenting magazines that you read when you were pregnant, but actually your family is your family, unique, and it's special to you. Don't worry about what everybody else is doing. As you've just said, every child is different, and you have to do what's right for your child and for your family.
Absolutely. Now, many of the people listening will be parents of children with a learning difficulty or a disability of some kind or another, and will quite probably have spent some time dealing with medical professionals. Now, you are a mum and a working medical professional, So as a doctor, I'm guessing that Amy has taught you a lot about people with Down syndrome.
Massive amounts, yeah. We heard very, very little at medical school and beyond about Down syndrome. I remember one lecture, I think, off the top of my head. And I didn't know anybody with Down syndrome before Amy came along. And all I knew from textbooks was that people with Down syndrome are more likely to get heart problems, along with a list of other things that I didn't have any actual proper experiences to draw back on. But she's taught me, again, that everybody's different and that there isn't a particular type of person that is a person with Down syndrome. Amy is Amy and her Down syndrome is part of her. She's also taught me an awful lot about what happens when people with Down syndrome get ill. People with Down syndrome in general are at more risk of many, many different health conditions, which I didn't know about even as a doctor. And so she's taught me an awful lot about how to recognise serious illness in people with Down syndrome.
I mean, talking about illness, I mean, I've heard you talk about soft signs of illness and, diagnostic overshadowing. What does that mean?
They're pretty much my favourite phrases at the moment. So diagnostic overshadowing is when somebody has a pre-existing diagnosis and healthcare professionals put any new symptoms or signs down to that pre-existing diagnosis. So, for example, a baby with Down syndrome might present being quite floppy and quite quiet, and the doctors and nurses might decide that that's just because they have Down syndrome, rather than looking for signs of infection. Or a patient with autism might be quite agitated or anxious, and again, somebody might put that down to just having autism, rather than looking to see if they're in pain or got an infection, for example. As medical professionals, we tend to use a lot of scoring systems and lists of symptoms and signs to decide how sick somebody is. But sometimes those things don't work, and that's particularly true of people with Down syndrome. They might not necessarily get a fast heart rate when they're unwell. They might not necessarily get a high temperature when they're unwell. And their behaviour can sometimes be difficult for health professionals to pick apart. Families will know whether or not somebody's behaving properly, but it's difficult for a health professional to know whether that behaviour that they're seeing is normal for that person or not. So there's more and more effort looking into soft signs now. And soft signs are things that you don't need to be a medical professional to pick up on. And actually, families are probably better than medical professionals at recognising them. And they're different for every person. So it might be, for Amy, for example, her soft signs might be that she doesn't want to play on her iPad. She's not interested in her favourite TV programme. She doesn't want to eat her favourite food. And those things will tell me that something's wrong with her. And I might not be able to put my finger on it straight away, but there's enough there to let me know that something's up. And I think as medical professionals, we need to start listening to those things that families are telling us about how somebody's behaviour might be different and how they might be appearing to be different to them.
That's really interesting, and I think lots of medical professionals would be wise to listen to your words. Now then, you're dedicated to improving healthcare inequalities for patients with learning disabilities. And at the start of our talk, I mentioned that you created an infographic. Can you tell us a bit about it and why you felt the need to make it? And maybe also how it's been received by the medical profession.
So a couple of years ago, I was involved in a Twitter conversation with lots of other emergency medicine professionals. And it was in relation to the cases of Jack Adcock and Krishan Sorjani, who were two little boys who died in separate cases in Leicester. They both had Down syndrome and they both had sepsis. And there were issues around how quickly that sepsis was recognised. And it became really apparent to me that there was lots of things that I knew about how sick children with Down syndrome can get that my colleagues didn't know. And a lovely lady called Linda Dykes, who's an emergency medicine consultant over in Bangor and has put together lots of infographics for lots of different topics, suggested that we work together to help to share awareness of those things with the medical community. So we put together an infographic and it was released on Twitter and on Facebook, and it was absolutely outstanding. I was expecting a few people to share it and a few people to show some interest, but we had about 100,000 hits on that infographic, and it has blown me away how well it's been received, and not just by medical professionals but also by families, which has really, really been something that I've been really proud of. And off the back of that, I've had so much more opportunity to spread awareness. So following that, I was asked to write a blog for the Royal College of Emergency Medicine. and have also been able to do podcasts for the Royal College of General Practitioners. I've been working with paediatricians. I've been able to speak at conferences for paramedics, and I'm currently involved in looking at adding to the guidelines for paramedics to make sure that they're more aware of issues with people with learning disabilities. So there's been so many opportunities that have arisen from that infographic, which I'm really, really grateful for.
Oh, wonderful. And the infographic itself, I mean, how would you describe what's actually on the infographic and what it tells us?
So we wanted to keep it fairly simple. I think we've got 10 different points on there, and they're things that we want medical professionals to realise when they're assessing children with Down syndrome. So things like the fact that they might not control their temperature in the same way. So often we look for a high temperature in a child as being a sign of serious illness, but a child with Down syndrome might not have a high temperature. There's also some hints on there about communicating with our children, and some hints on there about how illnesses might not present in the same way. So pneumonia, for example, might present with some diarrhoea and sickness in the early days. So top 10 tips for assessing children with Down syndrome.
Is there anything you can think of that parents could do to help medical staff when taking their child with learning disabilities to a hospital?
Yeah, absolutely. Parents know their children best, and a lot of this is around the soft signs again. So if there is something that you think is not right, try and let the doctors and nurses know why you think that. So even if it comes down to something as simple as they're not wanting their tea and they normally would love it, make sure that they understand that that is a sign that they could be quite unwell. The other thing is helping the doctors and nurses with things like sensory processing. All our children are different, and some will respond really badly to different sensations, and that can make examining a child with Down syndrome really difficult. So knowing, for example, that they're going to be scared stiff by the light that we put on the end of the finger to check oxygen saturations, or that taking a blood pressure is going to be really distressing to them, can help the doctors and nurses to find different ways of doing those things. And the last thing would be around distraction. We use a lot of distraction when we're assessing children, so blowing bubbles, looking at books and things, and hoping that children won't notice the horrible things we're doing to them. But I know that Amy has been in and out of hospital so many times that the second she sees that Where's Wally book open or the bubbles come out, she knows something horrible's happening. So don't be afraid to tell medical professionals that your child is not distractible, just crack on with it. So I think any sort of hints and tips that help the staff to know your child better are really, really worthwhile.
So as part of the medical profession, you've learnt about Down syndrome and other learning disabilities, but have you had any other support from other areas once Amy was born?
Absolutely. So I was very lucky to meet some other families when Amy was very young, all with other children with Down syndrome. And a couple of those families were already working to put together a local support group, which has grown massively in recent years and has been a really, really wonderful lifeline to our family and to so many other families in our area. So Downright Special in Hull and East Yorkshire have given me so many friends and so much help and support over the years. I'm incredibly grateful to them.
And I mean, going back to Amy, I mean, what are your hopes for Amy's future going forward?
Same as any parent would have for their child. I want her to be happy, and I don't mind so much whether she works or whether she doesn't. I'd like her to be able to be happy and to enjoy the life that she has, and I think that's probably true of all parents and their children.
Well, happiness is the key to life, so you're absolutely right there, and I think that's a great way to end. So Liz, I'd really like to say thank you so much for your time today. It's been great to talk to you and to find out about Amy and the work that you do, not only to help parents but also your colleagues in understanding how to communicate with and look out for signs of illness in our children. So thank you very much.
My absolute pleasure. Thank you.
My name is Richard Bailey. Please do listen out for more Shifting Perspectives podcasts.
We hope you've enjoyed this edition of the DSA Shifting Perspective podcast. You can find more of our podcast via the DSA website or at Spotify and Audio Boom and Apple Podcast and other podcast platforms. Please subscribe and tell your friends about us. Thank you very much for listening.